The government of the State of Eritrea has prioritized community-based health services as a key service delivery strategy for primary health care. Although the government is operating 351 health facilities, including health stations, health centers, and hospitals across the length and breadth of the country, the communities in very hard-to-reach areas cannot access any of these health facilities for regular health services. In order to reach these communities, the government has devised other strategies to provide services to the most vulnerable women and children. Among these strategies are outreach services from the health facilities to communities who live within a catchment area of 10 kilometers from health facilities, mobile clinics to outreach points beyond 10 kilometers from the health facilities, and the Barefoot Doctors. The Barefoot Doctors are frontline health workers trained and equipped to provide essential health services to the populations living in the remotest communities of Eritrea. They are required to have a minimum level of education up to grade 6 and an ability to read and write in the local languages. They are trained and deployed to provide services in the hardest-to-reach communities that have no access to health facilities and which can only be reached on foot or by using camels. These are the communities that the health facility staff are unable to reach easily, even through the mobile outreach services. The Barefoot Doctors were part of the human resources during Eritrea's liberation war and were introduced in 1981 as part of the public health system. The government of Eritrea prioritized the revitalization of the Barefoot Doctors program in 2018 in order to strengthen primary health care through community-based health services for the very hard-to-reach rural populations that do not have access to health facilities. The Barefoot Doctors program is a temporary measure that will be used to provide essential services until new facilities are constructed in these very remote areas. With support from UNICEF, the first batch of 25 Barefoot Doctors received a 6-month training and graduated in July 2019. The 6 months of residential training consisted of 4 months of classroom learning, followed by 2 months of intensive practical training at the Barefoot Hospital, other primary health care clinics, and within the nearby communities under the supervision of the trainers. The training comprised a package of preventative, promotive, and curative health and nutrition services. They are trained on first aid, identification of certain diseases and treatment or referral to health facilities, mobilizing communities on health, nutrition, and environmental campaigns, supporting the health workers during vaccination programs, and providing necessary support to pregnant women, including some simple antenatal care services, and encouraging them to visit and to deliver in health facilities. The training also included the care for mothers and newborns after delivery and counseling on infant and young child feeding practices. The first batch of 25 Barefoot Doctors graduated in July 2019, and a second batch of 62 Barefoot Doctors graduated in April 2020. To date, a total of 87 Barefoot Doctors, which include 12 women, are now serving their communities. The 87 Barefoot Doctors have now been deployed to their respective communities, and they are now active in all the 6 regions of Eritrea. The Barefoot Doctors have been trained to provide an array of basic health services, and their 6-month-long training makes them an invaluable component of their community in the rural areas. The trainings even include identification of health and nutrition problems beyond their scope. These include danger signs of pregnant women and sick children. Once they identify these problems, they promptly use a referral slip to refer the sick person to the next level of treatment, either to a health station or a health center. Sometimes, they need to personally escort the sick person to the health facilities. The Barefoot Doctors are also trained to identify undernutrition and common childhood illnesses and to provide basic essential medicines for the treatment of diarrhea and water and sanitation-related illnesses. They also conduct health education on personal hygiene and environmental health and raise awareness on many key health topics and issues. One of the key health-seeking behaviors that the Barefoot Doctors try to promote is to encourage pregnant women to seek antenatal care services and to deliver in a health facility. They provide micronutrients to pregnant women and encourage them to seek access to medical services. Their advice will help them to become healthy mothers who in turn will give birth to healthy babies. Pregnant women and lactating mothers are also provided counseling on maternal, infant, and young child feeding practices so that mothers are aware of their dietary needs as well as that of their infants. The Barefoot Doctors are lifesavers in their community as they are provided with a stock of essential medical kits and medicines. They have extensive knowledge of the usefulness, side effects, and storage of essential medicines, and they are authorized to use them and to provide demonstrations and advice on using them. The Barefoot Doctors are but just one pillar of the government's strategy to strengthen community-based platforms to provide basic health care to all the citizens, especially those living in remote and hard-to-reach areas. Besides providing basic health services, they also collect and share critical health information and data with the sub-ZOBA health offices, and are in turn provided with supportive supervision and also participate in monthly and quarterly meetings. UNICEF is supporting the government's Barefoot Doctors program as part of the strategy to strengthen community-based platforms in Eritrea, using in part the 7% set-aside funds from its headquarters. Part of the support is extended to the mobile health clinics, the training of community health workers, and the provision of critical medical and nutritional supplies for children and women, particularly pregnant and lactating women. The government will need to devise more sustainable and appropriate incentives for these hardworking men and women, and to ensure that they complement the work of the community health workers, and that they maintain strong linkages with the health facilities in their respective regions. Through review meetings and supportive supervision and replenishment of their supplies and collate data, which will be incorporated into the National Health Management Information Systems. The service of the Barefoot Doctors is viewed as a temporary measure, and eventually, the government's plan is to establish health facilities in these hard-to-reach communities. The Barefoot Doctors will then, according to their capacity and performance, either be upgraded to the level of community nurses, deployed to work as community health workers attached to these new health facilities, or phased out into retirement from their services. In the meantime, these hardworking men and women are out on the front lines, going to the last mile in order to reach every child and woman and individual, and to provide them with basic health services to ensure that no one is left behind.